So, regulation, what's happening today? I want to begin by sharing with you where things are at right now. I know many of you are eager to hear. The government of Alberta recently convened a mental health and addiction recovery workforce advisory committee. And the committee has been tasked with advising on current and future workforce needs within Alberta's recovery oriented system of care and health workforce strategy. And regulation of the counseling profession is being examined within that broader workforce context. So that's great news. And also, great news is that ACTA has been invited to participate and collaborate meaningfully as a partner in this process. So, this is really important. This means that regulation now is not going to be discussed in isolation, and there are good opportunities to consider it within the full picture of Alberta's refocused health system, and that we are contributing directly to that conversation. You might have seen this quote from
Nicole,
Minister.
sorry to interrupt. The slides aren't sharing. I don't see them.
Wow, we worked so hard on those slides. I am definitely going to make sure people see those slides. Thanks for telling me. Okay,
There we go.
well, see how pretty the first one was? We were welcoming you. That's what I just said. And now you get to see Minister Rick Wilson and his quote. And this was in our newsletter recently, so you may have seen it. And he said that our government remains committed to regulating the counseling profession and working collaboratively with ACTA on a clear and effective path forward. And this reflects also the perspective that he shared with Laura and I all the way back in July, and he's quite newly in the position at the Stampede, and also a few months ago when we spent some time with him at the Recovery Conference. And so this really matters. It confirms a couple of things. First, that regulation remains a government priority. And second, that ACTA is recognized as a partner in that work. So this is not advocacy from the sidelines. This is a very different place that we're in now, which is good. It is participation within a defined advisory structure and path forward. And I'm going to hand it over to you now, Laura.
Thank you, Nicole. And you might want to put your slides on the full screen. I can see your tabs and
Okay.
the foreshadowing and what's coming next. I'll just give you a minute to put it up.
Got all my texts and everything. Okay, sorry. I'm going to get it right this time. This is the one. Um, yes, we're there.
We're there. So now going
Okay.
ahead,
We
we're
had two
on.
town halls today. For the next one, I'm going to have it exactly right. But thanks for your patience, everyone.
Thanks. So the Mental Health and Addiction Recovery Workforce Advisory Committee. This is a significant committee, and there's good reasons for that. One of the reasons is that this is a collaborative committee under the Ministry of Mental Health and Addictions, which is Minister Wilson, but it's also under the Ministry of Primary and Preventative Health Services, Minister LaGrange. Minister LaGrange's portfolio includes health workforce and the Health Professions Act. So professions coming into the Health Professions Act fall under LaGrange's ministry, and that workforce department falls under LaGrange's ministry. So having both ministries at the table is very helpful and a good way of moving forward with regulation in a good way. As you've known, our file has always straddled these two ministries. When we first started working on regulation, there was only Ministry of Health. And since then, that parceled off to an associate ministry, and now its own separate Ministry of Mental Health and Addiction, and now health also separated in four. So the fact that we actually have both ministries and departments underneath those working together at the table is really significant, and that ACTA is included and invited into that process from the get-go is very important. So what is it? We are, it's a time-limited provincial advisory committee, It started in January and it's going to be going until the fall. So it's until 2026 within this year. It has a really specific mandate, and that is to build a sustainable and integrated mental health workforce, make sure that it's supporting recruitment, retention, workforce stability. Also, very key is that it's making sure it's the professionals within that profession are working to their full scope of practice. And for many of you here, you know that that's a significant issue when you're not regulated, is that you're not able to work to your full scope of practice. So it's also working on identifying the risks and looking at access and equity and being able to move through those in a way that's going to expand and sustain the workforce. So, like I said, ACTA is an invited partner in this process. This is an actionable step from meetings that we had with the ministry last fall in September. And we're recognized as a collaborative, knowledgeable partner representing regulation. We've done a lot of work on regulation, and that's recognized, and workforce partnership, being able to understand the landscape of the workforce. So our role is to contribute meaningfully as collaborative partners. We're making sure that counselors are appropriately understood, positioned, and included in these workforce discussions. So we are contributing both the profession-specific information that's grounded in the real practice, which again goes back to that survey. It's that you're going to keep hearing every time, but that's how we're going to be collecting a lot of that information to help on this committee. And that we really realized over these years of working on regulation that it's not just regulation that matters, it matters, like for sure. But it's also how regulation is shaped that also matters. So that is what we're working on. And I'm going to pass it back over to Nicole to talk about why it's through a workforce lens.
Great. And just before I continue, I just want to mention that Laura's going to open up the Q&A a little bit later in the presentation. So if you want to start thinking about what questions you have, we will definitely have time at the end to answer them. And we would really like you to wait to put your questions in the Q&A rather than in the chat, so we don't lose the questions that you want us to speak to, but feel free to make comments in the chat. So regulations, we said, is now being examined through a workforce lens. And so let's take a few minutes just to talk about why that is. And so first of all, it means that the government has already accepted that regulation protects the public. That's the case that we've been making. The primary case always to make for any kind of regulation is for public protection. And we are well beyond making that case. And so the primary question now, though, is how does regulation strengthen Alberta's mental health workforce? Alberta, as we all know, is facing workforce shortages. And we also know that labor mobility is a priority and that access gaps remain across regions and populations. And so without regulation, counseling therapists cannot be authorized for the restricted activity of psychosocial intervention. So this is the first of a lot of very significant structural barriers that we face without regulation. Without regulation, counselors are excluded from certain publicly funded roles, not able to work in the healthcare system in those roles, face barriers to NAHB billing, a very significant one and an ongoing concern for us and many therapists, not being able to offer those services to Indigenous populations. And of course, we've heard Treaty 6 and 8 speak very loudly to this and the importance of regulation for this reason. And any of us in private practice, or seeking counseling for our own selves and families know that there is still limitations in terms of direct billing platforms without regulation. And also that exclusion from full interdisciplinary participation, which of course is important to providing good service to Albertans as well. That's very important to clients. And there are unclear educational pathways, which affects anyone moving into the field, very difficult for the students that we currently have. And so there really is little value and great risks, I would say, to mobilizing a workforce, a regulated workforce that cannot actually work to its training. Counseling therapists need to be able to work to their full scope of practice, including restricted activities. And so workforce planning requires clarity about who is qualified to do what and where. And that's why regulation and workforce are inseparable and why it's being looked through this lens right now. So we've mentioned scope, and so let's just take a moment to stop and look at what we really mean by that. So all of what we've just described, restricted activities, exclusion from roles, limitations in billing, and integration in the system, all of that comes back to scope. If counseling therapists are going to be fully integrated into Alberta's refocused healthcare system, we need clarity about what scope actually means and what it doesn't mean. So, as you know, right now in Alberta, counseling therapists are trained and competent but restricted. And so regulation, it doesn't artificially increase what anyone is allowed to do. It authorizes professionals to perform within their competencies and provides protected titles for clarity to the public about who has the competencies of the profession. So under the Health Professions Act, the HPA, every regulated professional is limited to practicing within the competencies that they have acquired. Scope functions as an umbrella. So things like competency and job description will determine what you personally perform within that umbrella. So a couple of examples of this is that although formal assessments and diagnostic reports are in the full scope of practice for a registered psychologist, not every psychologist actually does formal assessments working with children within the full scope of practice and training for a psychologist, but there are some who don't work with kids. And if they were to start to work with kids, they would need to develop that competence and have a strategic way of doing that. And so examples outside of our profession are pharmacists complete additional training and they'd have to apply to their college for prescribing authorization. And in nursing, physicians as well, although that scope is wide, not all of them perform every kind of specialized procedure. So you can see that the legislation already contains important guardrails. What thoughtful regulation ensures is that that umbrella is broad enough to meet Alberta's mental health demand now and also in the future. It needs to allow the profession also to grow over time and individuals to grow over the span of their career without narrowing or compressing the profession unnecessarily. So scope, again, isn't about expansion for its own sake. It's about progression of competencies and meeting demands safely and effectively. Over to you, Laura.
Thanks. So as you know, ACTA supports grandparenting and workforce stability. That's been a key part when we started working on regulation for quite some time ago, that the government has always been clear with us that we need to, and especially when you're looking at this real workforce lens, is that this is about sustaining the workforce and being able to have a process to be able to assess the competencies and entry to practice competencies of people who are currently providing those services. So ACTA supports that and making sure that people who have acquired the competencies through different pathways, including, and most typically it is the education pathways, but there are some other people who have been in the field for quite some time that have acquired that through diverse education, workshops, supervision, clinical experience, and so forth. So it's really important that we're not disrupting the workforce and that we also have a pathway in to make sure that that it's evaluative, that we're able to see that the future workforce is also not going to be negatively impacted. So those are pieces that have been done for quite some time that ACTA has put forward to the government over the years, even before we had the legislation in 2018. So a big piece is that ACTA's registration system does exist for this purpose. It has always aligned with the Health Professions Act. Good character policies, fairness, competency-based knowledge, making sure that it positions counselors for transition into the regulated structure once proclaimed. So it demonstrates readiness, organization, feasibility, all of the essential workforce planning environment that is needed. This is a big piece. The registration system and the people who are on a registration system have also gotten us to where we're at right now, being able to be in these really significant positions and respected as a unified single entity only working on regulation. That is our purpose in Alberta, is to regulate the profession in a way that aligns with the profession, supports the full scope of practice, and that is going to increase access and safety for Albertans. So back to you, Nicole.
So let's just talk for a few minutes here about the different roads to regulation. We have been on the road to regulation, I know, a very long time. I know you feel it. Trust us that we feel it as well. Under the Health Professions Act, there actually are two legislative pathways. So we'll call them two roads available to regulation. So, and we have been on both of these roads, haven't we? Already. And so one of them is regulation with a new college. So as you know, at one point we had legislation, and ACTA was to become the College of Counseling Therapy of Alberta, and we were very close to opening that college, and that was the way that regulation was going to happen with three counseling professions for us. Um, and then time passed and many things happened, and we also ended up on the other road to regulation. And that was when the government said that the direction for us, their preferential direction, was that we would be regulated by an existing college. And we always knew that there was some reticence of government, this government and the one before, to increasingly open single profession colleges. We were going to be the last one. And as time went on and regulation didn't happen for different reasons, the government thought that that would be the best road for us. And so now, 2 years since then, over 2 years have passed, and there's been no progression along that road about being regulated with another profession, specifically the College of Alberta Psychologists. And so the government is assessing now the path forward within the broader context of workforce planning and system redesign. Because in that 2 years, the healthcare system changed a lot. A lot has changed, and the government really wants to look at it again according to the current workforce and the way that the system looks today. And they are making those decisions, contemplating which road we're going to be on, how regulation is going to unfold with ACTA and stakeholders as part of that conversation and process that Laura described within that committee. So here is a really key point that we hope you'll take from the webinar today, that which of these two roads we are on is not the core issue. We can be regulated as a single profession college. We can be regulated along with other professions. That happens a lot in other provinces. There are lots of examples, even in Alberta, of different professions being regulated within the same college. What really matters is that regulation is implemented thoughtfully and strategically. So this is what is so important about the fact that we have created ACTA together, and we have a strong unified voice about regulation that's part of the process, because the decisions that are made about regulation, they will affect generations to come. The whole shape of our profession for generations. It is very hard to change scope, to change legislation over time. And so we want to be part of this practice. And the way regulation happens, it has to uphold the scope of practice for our profession. It has to support workforce integration into the refocused health system. And it has to expand public access, not restrict public access. And we are aligned with the government on the importance of all of those things. And the question is not who regulates, but how regulation happens, so that it upholds the scope, workforce capacity, and public access. And the government continues to be clear that the regulatory framework needs to align with that current and future workforce. And so ACTA will continue to contribute our resources and represent the profession on whichever legislative path is chosen. Government has a lot of trust in us that is true because we have very faithfully supported regulation in any way that can happen. That makes sense for the profession and the public, and will contribute in any way we can. And we also remain the voice of urgency because that is also important. How it happens, and that the government has the public has these protections in place quickly, and that access to the public is increased as quickly as possible when done in the right way, and that we will always, look for ways to contribute to efficient ways of doing this, and will always provide creative solutions where we see them and be a good partner. Again, it's been a very long journey towards regulation, but we are really optimistic that this process will be successful in finally bringing it to completion, also in a timely way in the public interest, that we will have clarity in the fall about how this is to happen, and that we will have generated enough urgency as well, and trusting that the government will commit to actioning that pathway in a timely way.
So the survey, this is exciting. So as part of our participation, we needed to gather the profession-specific information from Alberta, anyone really providing services to Albertan clients. Most of you are from Alberta, but there are some people that service Albertan clients from distant as well. So it is aligned with the Mental Health Advisory Committee mandate, and that alignment is very intentional. The government is doing some of their own surveys and collecting workforce data to be able to present to the committee. We know a lot of counseling therapists, psychotherapists, counselors are external to the primary structures of health because they're not regulated. So this is our opportunity to be able to collate the information from the profession and put it together at the system level planning decisions. So the government already understands that regulation matters. They understand it's for public protection. The focus is more now, like what Nicole was saying, is it's how is this going to strengthen the workforce and the addiction systems? How is it going to secure access for Albertans, because they need to improve that with mental health and addiction. So the survey is really going to help us demonstrate the size, scope, distribution, and capacity of the counseling profession across Alberta. So policy decisions are shaped by evidence. Well, good policy decisions, I probably need to preface that, and we are putting forward some really good policy decisions that are going to be a positive impact for Albertans for sure. So when we are looking at the survey, we're looking at broad participation across all of Alberta. That's really important. And I'm going to walk through some of the pieces of the actual survey if you haven't done it. And if you have, it might kind of help explain like, why was that in there? Because sometimes we get questions about that, like, why was that there? So it's structured into strategic sections. So part of it's profile, where are you working, what services, what's your roles and titles that you use. Titles is a funny one. We left that open because we know everyone's there's a variety of titles being used. That's also part of the confusion for clients and Albertans when they go to seek services. It's hard to know who's who in the zoo. So titles, we're also looking at your workload. What is your current workload now? What do you intend for it to be a future workload? Would that future workload shift if regulation were to happen and you could expand services? How would you be able to expand services? There's different scopes of practice recognized in the survey. So a lot of people are doing frontline counseling, in person or Zoom, but we also, which is great to see, we have people teaching, researching, putting out evidence and data, private business. You're going to see a whole lot of different sections in there, and it really shows the breadth of the profession that already exists and really needs to be regulated. We're also looking at a national lens. So regulation And the government has been looking at national lenses for a while on labor mobility. If you're moving from other provinces, and you know the government talks about this, having everyone come move to Alberta. Well, we can't credential and there's no labor mobility unless we have regulation and we can honor some of those systems across the province. Also internationally, we actually have quite a few people from the States starting to move to Alberta and are completely shocked that we have no regulation for this profession and really start to look at other places to live and provide their service because they're used to that full scope of practice. So credentialing, financial implications, the non-insured health benefits, tax, the GST component, also how health spending. You can't qualify to use your health spending on an unregulated professional. That's part of the CRA structure of that. So looking at the national lens as well. And then education and workforce development, making sure there's those future pathways for regulation and competencies and the workforce can be sustained over time. Not just sustained, it's to grow. I think that we're a very healthy profession and the evidence is showing even over the last couple of years that how many more people are choosing this profession, which again does speak to the need to have that umbrella to oversee and some guardrails as people are moving through different stages of their profession coming in and moving through. So the survey code, snap it. I think Kelly also put it in the chat. I may or may not be looking over to see if our survey increases over this time. Share it. This is actually really important as well. It's hard to reach every professional working in Alberta. When you're unregulated, you're not under a single umbrella. So some of them are through associations we're reaching that way. Some are in different pockets on network, social media, all those different things. So the sharing of it and reminding people if they didn't attend this, it is important and valuable. So please do it. I have one extra thing to add on this is there is a draw if you complete the survey, an optional draw for $100 credit with ACTA. And I do understand at the beginning of the survey, there was a glitch with that draw. If you completed the survey and it wasn't working to let you put your email in, please email the office and we will make sure you are entered into that draw.
I'll just say a couple more things about this survey, and then I'm going to hand it back to you about what's next, Laura. But um, we we've had a good response. We believe, and the evidence is that there's over 4,000 unregulated counselors in the province. We aren't going to get 100%, but as you can imagine, it's very important for us to get as many as possible. I'm trying to remember the due date. We've got about a week left, and we have about 1,100 responses. We really want to, it would be great to get 50%. So it'll get more challenging as we, try to reach, those people who didn't immediately open it. And more now, we are relying on all of you to help us with this survey. It was sent through all of the associations, all of ACTA members, but now we need all of those people to share it with their colleagues, a little bit of peer pressure, healthy peer pressure, maybe. If you haven't filled it out, maybe people haven't come to the webinar and don't realize how urgently we actually need this information to directly present it to government and that committee very soon. So please ask your colleagues to fill it out. It doesn't take very long. And think about people that you work with who might not have heard about it yet if they're not members of ACTA or an association. And so think about who you trained with, maybe who you've taught before, past colleagues. I found it really helpful to just put it in a text and copy it. And then I just texted it to all of the counselors I know because people get busy. And again, maybe it just hasn't landed on them, how important actually this is for us. So please help us get those numbers up. Yeah, Laura has put in here, the deadline is not September, March, the 24th of this month.
Oh, I am committed. It's September this month right now.
Yeah, I know. Yeah. And so, share it intentionally. It is very important that we get that. And it's fun. I haven't tried this approach for selling yet. It's a fun survey. in that it's really informative. That is the feedback that we have mostly gotten from this survey, is that people are learning a lot because we all have our little like lens that we're coming from in private practice, working in an organization, like we're teaching research, we're like we have our lens of why regulation really matters and the barriers that exist. And this really helps bring us up all to speed when you read it, about what this really means for our profession as a whole, um, now and in the future. So, yeah, I think I hit on all the main points. And then more broadly, Laura, just about where we're going next from here.
I am. And someone put, I am committed that this month that I am sitting in is September. Because Nicole, I put it on the survey. It closes September 24th.
I
I'm
know.
committed. Something significant happened on that day. I'm going to have to go back and look in time. I've corrected it on the survey. It now says March 24th, which is much more reasonable and much more urgent. So please spread that it's not September. Okay,
Yeah.
what's next? The committee is going to work and over the next coming months, and this is going to be a significant part of the work plan, is working with the committee for the government, going prepared, significantly prepared for each of the topics as they unfold. So we are going to remain fully engaged and available for that process, contributing the workforce data, regulatory expertise, practice solution that aligns with the refocused healthcare system and evolving mental health and addiction strategy. The direction for regulation will be shaped within that workforce context. We're going to remain ready, engaged, and mobilized towards regulation. I think that is the feedback we have continually got from the government, especially over this last year, is how what a good partner ACTA is. Like anytime they ask for information, they know basically anything else we're going to put that together and get that to them thoughtfully, professionally, and support their decision making or information that they need. So we're going to continue to do that and be ready. We are also in the middle of renewal season, so it's a busy month. We have Kelly and Leah processing renewals. If you are currently an ACTA member, please complete your renewal sooner than later. That is very helpful to us as we're kind of working through some of these other pieces as well. And if you're not yet an ACTA member, please join now. We need the numbers to be able to recognize when we're looking at the size and scope of the profession. ACTA's registration system is the starting point for that while we're working.
I'm going to talk a little bit more about why membership matters, but just speaking in the chat, someone asked if the government's sharing the survey. So remember, they're doing their own survey. And this is like our responsibility is to capture the counseling profession. And so we're the ones creating this survey, and getting the data and presenting it. And there's a mention about social media, and it is on our social media. And if you can share that to any counseling therapy forums that you're on in any way, through your own social media, that would be really helpful. And also, I will get to the membership piece, but just to give you a snapshot, like as we're seeing the information, like these are things we've always said about access, about the impact of the workforce on regulation, but the numbers are really impactful and actually you gives you a voice in that. So someone mentioned in the chat, a lot of people are choosing to work transition their profession because of this. So when we actually look at the data and numbers start coming in about, you know, and don't quote me, we're not done yet, but like if we're saying over half of counseling therapists have considered leaving the province, that well over half would increase their FTE, if regulation happened. Like think about how those things, those numbers, that data actually lands on government when they're thinking about the impact that regulation would make on the workforce. So yeah, so again, really helps to actually have that data to support what we're saying. Also, we just cannot emphasize enough why it matters for counselors to belong to ACTA. Um, Again, over 4,000 counselors in the province, and only about 1,200, a percentage of them belong to ACTA. ACTA is the way to support the process of regulation and actually make the difference that we're talking about. ACTA doesn't exist without its members. So everything that we've discussed, our ability to sit at the Workforce Advisory Committee, our ability to contribute to regulation design so that it actually happens in a way that supports the profession and the public now and in the future, our survey, our credibility with the government, the fact that we have really long-term relationships with people who are working in the departments in government, that they know us, that we are able again and again to develop the relationships we need to with elected officials. You know how often that's changed, and the ministers have changed, and we work very hard to develop those relationships. All of that exists and is possible only because counseling therapists chose to organize under ACTA. Regulation can't happen for any profession ever with 14 associations and people who don't belong to associations. One of the fundamental criteria for regulation has always been, continues to be, that there is a single unified profession that's identifiable by the government. We've accomplished that through ACTA, all of us together. But again, we really all need to be under that umbrella and members of ACTA. We represent the coordinated, organized profession that has the infrastructure, the accountability, and the data. And the government asks us all the time, how large is this workforce? Who's qualified? Who is ready to transition under regulation? What does this look like? And we know that through our member registry and also the survey, but the member registry is really key. Our registry answers those questions, and we only have that registry. We're only able to do all of the work that Kelly and Lee do and that Laura does to be able to maintain the registry, to register new members, because that is what the contributions of our members go towards. And so it demonstrates that we are ready for regulation and that we're unified and organized. All of the things that even make us, at any point that this happens, qualify for regulation. So current members, thank you for taking us this far, for the way you're going to take us across the finish line. Your renewal sustains that infrastructure and positions you for transition under regulation and to support grandparenting and workforce stability. If you aren't a member yet and you want regulation shaped thoughtfully with counseling therapists at the table, and with the full scope authorization system integration, you need a strong professional body at the table, and that is ACTA. And so we would ask that you become a member of ACTA to help support the process and the completion of this. And this is really embedded also, if you look at the legislation, it requires that any application for regulation comes from a group of professionals. That can't be done individually. And so we'll continue to advance that work and continue to be a key partner with the government. And so, yeah, and in terms of membership, please feel free to talk with your colleagues as well about why it matters to belong to ACTA. We find counseling therapists just often don't know why that piece is important. And also we have membership webinars that Kelly and Laura hold every month very regularly. There's one coming up yet in March, I believe. And so that to help kind of guide people through the process of applying as well. So one more time before we answer questions, here is the QR code, and please help spread the word for your colleagues to fill out the survey, number one, quickly, and also to become a member of ACTA, so we can get where this road actually leads. You have our contact information. You're always welcome to contact